The last 2 days, it's been almost 3,000 cases per day. And what you have to do is put that against the backdrop of the previous 7 days, where on each of those days, the kind of case counts we've seen through testing have been in the range of, shall we say, 1,400 to 1,700. So this is a big change. It's now consistent over 2 days, and it is of great concern at this point. I think, we've been able to relax a bit over the summer. The disease levels have been really quite low in the UK through the summer, but these latest figures really show us that much as people might like to say, oh, well, it's gone away. This hasn't gone away. This is a virus we're going to have to live with. And if we're not careful, if we don't take this incredibly seriously from this point in, we're going to have a bumpy ride over the next few months. People have relaxed too much. And now is the time for us to re-engage and realise that this is a continuing threat to us. It's all very well saying that hospital admissions and deaths are at a very low level in the UK, which is true. But if you look further into the European Union, you can see that where case numbers rise, initially in the younger parts of the population, they do in turn filter through and start to give elevated rates of disease and hospital admissions in the older age groups. And we know that that then becomes a serious public health problem. So that's my concern, that if we don't get on top of this, if people don't start to take this seriously again, then there is a risk that that's where we will end up. And let's be clear that the epidemiology is very clear that there is a rise in all age groups, but it is really, really much more marked in the 17 to 21 years age group than any other. And for the first time, I think I see a trend that this is no longer about disease in those specific hotspots, such as Leicester a few months ago, the Northwest more recently, but there is a more general and creeping geographic trend across the UK, across England, that disease levels are now beginning to turn up on a wider basis, wider geographical basis. And that again is really a signal that we've got to change this now, got to start taking it seriously, very seriously again.